actually here at a fascinating facility in San Francisco in what is now considered to be sort of ground zero for early stage ventures and the startup community in general, and the facility is called Runway. What's really interesting about Runway is that there's actually a number of early stage ventures here, but then also several countries that have set up shop right here. So it's truly a global facility. I think Portugal is represented here, Germany and Australia, and probably some others as well. We have a live audience, and I'll give you a rough idea of sort of what we'll be doing today. The first step in the process is going to be a panel where we'll have a general discussion around some of the trends that we're seeing in healthcare. And then we'll take a small break, and then as a function of the Healthcare Pitch Days finale, there will be a lineup of 7 individual healthcare startups, and these have been through a selection process already. So these are the actual finalists, and then so we'll be seeing their presentations live. So relative to the questions ahead, though, what we want to, I think, kind of frame up relative to where we are is this is sort of ground zero for a lot of early stage ventures and activity, and specifically in all things mobile. And it's a great launch pad in the sense of how that intersects with healthcare. And so, Mike, I'm going to start with you, in part because you have a very different slant relative to mobile healthcare and how that intersects with the patients that your organization represents.
Yeah, I think we're facing 2 sets of challenges. The same one that everyone's facing with the physician population, first of all, coming in and securing that data and dealing with a very diverse set of platforms. And then in the patient arena, really struggling to understand what the ideal platform is for that group of people to use. And with our particular area of focus, not everyone has the exposure to the smartphone type technology or the tablet technology, or even to necessarily broadband internet access. So how do we take the tools that are available to us and reach out to those folks and enable those technologies and make them useful for them, I think is the big challenge.
Who pays for this? And as an investor looking at early stage ventures, how much of that is an influence in the investing side of early stage healthcare mobility solutions that you see?
So, very important question, right? Ultimately, it's, who pays. There has to be value that's brought in through these solutions that addresses, one of 3 things as I see it. Right? One is improving the quality of care, right? Second is improving the patient safety, and then third is a reduction in operating costs, right? You're trying to become more and more proactive with the use of mobility and telehealth models is key. And there's an interesting dynamic, as we know, with the changing view from provider networks, going from a service for revenue model to a cost-based sort of here's a pool of dollars that we're going to work with and manage the health of the population, right? So to drive towards it, I think having solutions that are robust that can address any one or more of those 3 vectors that I pointed to becomes critical.
Awesome. Andy, give us some insight relative to what you're seeing for the opportunities in mobile health.
I think one of the things that has been either missed or maybe it's just still in its early stage, Dan, is the impact of the health plan CFO. And if you walk into a CFO's office today, they're the ones who actually sign the checks that the health plans are spending money on. They're looking for ways to drive improvement in their 5-star rating or their 3R measurements for the exchange models. And if there are solutions that drive to support those, they're going to get a lot of traction quickly, particularly on patient engagement or member engagement and member satisfaction.
Is there an intersect that you're seeing with ACOs?
Absolutely.
Okay.
Especially when you think about health plans and providers trying to get closer and closer. They often have their own legacy platforms. You've got to put some sort of skin over the top of that and then mobile enable it to make it really a true ACO model for them.
Right. Ben, give us some insight from Intel.
Well, what we've seen is that before the consumer applications can really be useful to consumers, we have to build out the clinical infrastructure so that the clinical data can be integrated with the consumer application so that they can actually be useful to consumers, so they can do things that can really have an impact on their health. And so we're starting to see with the High-Tech Act and with Affordable Care Act, adoption of electronic medical records, but until we get to meaningful use 2, we're not going to see a lot of sharing of the data between clinicians so that consumers can access that information. So it's really a very nascent market, but we're seeing a lot of progress there, and integrated organizations here in the U.S. like Kaiser have some of the most useful consumer applications because consumers can schedule their appointments or they can talk to doctors. And then the next step after that is once we're making the data flow, how do we make it secure? And that's sort of the next step in the process.
You have a sort of a different perspective relative to the constituents that you work with. And there's this kind of big disconnect between the idea that everybody has a smartphone. And so that's an automatic or a given in the sense of a baseline, but that's not necessarily what you're seeing. How does that influence what you're looking for relative to mobile solutions?
Well, I think you have to look for things that work across multiple platforms, first of all. So I think that's one of the things that I see is, designing down a single path may not be the way to go. We talked a little bit earlier on in a discussion before this meeting about things like text messaging as an option.
Right.
So, in the areas like maternal health or prenatal care, having text messages can be a very effective way to let a mother know that she needs to take your vitamins, show up for your appointment, do this, do that, eat these things, etc. And it's a very low impact, high impact, low cost solution that you can reach a lot of people without any very sophisticated technology. So sometimes it's maybe imagining things a little bit differently. And instead of taking the high-tech route, maybe a slightly less, a bit more low-tech solution, leveraging all the same tools though that you use for the high-tech solution can bring just as much benefit. And I think that's the thing that everybody's looking for here. It's the quality piece, it's the outcomes piece, because that's really what we're driving towards, is measuring that quality and then having better outcomes for everyone involved.
So somebody asked me already, and I'll cue it up, but how did you get to 7 finalists with only 3 cities? And it works out that 2 companies came from each of the cities, which is 6, and then there was a wild card, and that was selected based on online presentation. And so that's the company up next, and that is Vivify.
Yes, sir. Thank you. Folks, thank you for having me here. Intel, Dell, thank you very much for giving us the opportunity under the wild card seat to present to you what we're doing in this space. We've got a lot of materials here, so please look at this. I'm going to keep it high level, but I've got to blaze through this material. I think it's appropriate to share some of my background within this space and what led to it. I had invented and patented the first ever table management system, which you know today as the front end when you go into a restaurant of OpenTable.com. Sold that in the mid-90s, and from that, believe it or not, led into healthcare. A company called ProHost led to MedHost. MedHost today is the leading emergency department information system in the U.S., highly integrated into all the health information systems, crosswalking all types of data, medications, and so forth. A full-blown EMR, and the first ever touchscreen EMR brought to healthcare. That is in, again, a huge number of patients in hospitals across the country. And really, 15 years of experience on understanding the healthcare processes is a critical factor in what we need to accomplish. The panel session was fantastic. The topics from usability to integration to device independence, all those were critical topics, and security is certainly a piece of that. So as a team, some of the key leadership from my last company came into Vivify Health, and we have great experience working together. We've been at it for 3 years now. We've got some pretty prominent partners, and behind all of this, we have everything that's needed from the security perspective as well as the FDA regulatory perspectives with mobile health. So we are that horse that's running fast, and we were the first at it. Here's a timeline of the company. You can see some pretty prominent partners and names. We've got Ericsson with a global partnership introducing us into network operators. AT&T is white labeling our product today as their remote care management platform or software as a service. You heard Airstrip referenced earlier. They've come to us and they've partnered. They're the experts at mHealth in the hospital. We're the experts outside of the hospital. Some prominent customers moving pretty quickly, proving outcomes as well with what we have accomplished. We have 11 provisional patents. Now, 6 of those submitted as formal patents expected to be completed before the end of the year. 2 of those are surrounding the use of smart TV as the user experience of the future. We're a device-agnostic platform. We don't care if it's a TV. We don't care if it's the smartphone, tablet, whatever it needs to be. And with that, of course, agnostic to the health devices that are associated with it as well. So given my past experience, I had the fortune of taking some early funding from the only 2 venture capital in the U.S., Heritage Group and Ascension, whose funds come from large health systems. So we have with us not only investors, but immediate customers. These are some very large health systems. They've got some very strategic initiatives, major health plans included with some of these. We've got case studies that are about to be published. Actually, 2 already have been, one with Memorial Hermann and another one with Christus. One of those is associated with a new model tying in the health plan. And so when we look at what was discussed in the panel sessions, including who pays, what's the value proposition, and so forth, that's a very critical factor, and how do you tie it into the overall workflow. So our solution overall is very patient-centered, designed from the beginning with a schema that allows access by anybody that plays the appropriate role in care and in the ROI process or revenue flow process. Provider, of course, payer, of course, and family members included, from the cloud to consumer electronics, and again, we don't care which consumer electronic to accomplish that. So looking at a different picture, it's end-to-end remote care. Where we began our focus is that high-risk, complex, chronic patient, the patient that is the 50% of cost in the U.S., and that patient that doesn't have a smartphone, has never touched an iPad or any other tablet of any kind whatsoever. Nobody has accomplished simplicity with this to date. Simplicity to the point the patient can take a kit home themselves, turn on the tablet, it just works. It's connected to the cloud. Their care plan is customized for any condition. It's back in cloud managed and deeply integrated into the information systems. We're integrated with Epic and many others. We're in partnership discussions with most of the major EMR vendors, the top EMR vendors. It also is a great solution for the numerous companies that are coming in that are building these call center services, disease management. Pharmas are getting into this. Of course, the payers are in a big way. We have some early payer opportunities that are about to unfold. I should say health plan opportunities. And with that, tied in with the health systems as well. Integrated the end-to-end ability to engage the patient with video conferencing. We're agnostic to that. We've got 3 partners in that. There are a few that we like that are great in rural settings. We've got this fully managed, the kit. We have kit logistics, all the components behind distribution, managing it with mobile device management, including remote control. We sign business associate agreements with their customers to ensure that we have that access to manage that for them and give them the tools to engage with the patient as they need. User experience is unparalleled. It's my passion. As a kid, I really wanted to be, the founder of Pixar, but that didn't happen. And as you can see from my past companies and moving into this one, it's all about the experience, which is perfect for these patients. The average age of our patients in our health systems and health plans is 78 years old. Many of them are in their 90s. We've got some case studies and materials that are about to be presented of patients who it saved their lives, it's changed their lives, and they're in their 90s. So we have patients with no problem using this platform, navigating through the appropriate experience, content, care plan driven, tied in with population health, EMRs, and so forth. And on the caregiver side, great statements made on you've got to work with caregivers. It has to be simple for them as well. That is critical. MedHost, emergency department, my last company, the most successful, the toughest part of the hospital, life and death, touch screens, we get it. And so taking that to the patient and provider, again, is a critical factor in making it simple and including all the appropriate educational content and materials built in and third-party content embedded as well. So we've got partners of all kinds and even relationships with the American Heart Association and others for the best practices in content and protocols. Video conferencing, I've already described that. And let's talk about ROI. So I want to get tactical. This is where it's at. So this slide is actually as old as the company with maybe 1 or 2 words changed. But our vision is to get to the consumer. Okay? But you can't get to the consumer until you first accomplish a solution for the provider to solve their financial problems and their other healthcare problems. So given our 15-year experience in health systems, that's where we began. We now have the opportunities, obviously, and are closing deals now with health plans, ACOs, and, of course, into the employer settings. And we're about to release a solution that brings in now family members as well. In that scenario, it's a BYOD market. No new devices for you, but still. Up here, It is hardware sold, new hardware sold, lots of it. A 200-to-1 ratio when you're looking at other systems that are focused on the provider side. This is provider and patient side. And every one of these patients needs that new hardware. It's not like they're using their own devices. A couple case studies. Memorial Hermann out of Houston has branded this their own solution. They're bringing concierge care with our platform, putting their own white label on it, and also selling it into health plans. So some outside health plans or payers, as well as their own internal health plan and an ACO focus. They've reduced their readmissions over 50%. They already had a fantastic readmission rate of 10%, which is half of what the U.S. Standard is. We made that even lower, half of that. Christus Health, another one. ROI, $2.44 published in HIMSS for every dollar spent on the platform. This was inclusive of Medicare, Medicaid, and fully insured patients in their ROI. This is published, great information, great case studies that we can refer back to in detail in follow-up discussions. Our customers are finding never-ending use cases for this. Obviously, home health, we're about to sell into some of the largest home health in the United States. But pre-discharge, I love this one. Give the patient the tablet at bedside when they're admitted into the hospital. Give them care plans that can impact their HCAHPS or satisfaction scoring upon departure. Use survey questions that can help determine what is the risk status of this patient. Use it to give them preliminary pre-discharge educational content as well. And a lot of other cases that are popping in here. We have some strategic partners that are pretty prominent. One of the things that we've recognized as we've started to deploy this into hospitals is that they can't scale the care themselves. They have these ambitions. They haven't been able to accomplish it. They need help. Envision just had a $6 billion IPO. They're the parent of AMR ambulances covering all 50 states and M-Care emergency physicians in about 600 hospitals. They're the biggest in the country for virtual care, let's call it, getting their feet on the street at this level of the 911 and into the hospitals. Now they've acquired some companies. They're building Evolution Health, the leading clinical care for a command center based in Dallas, where we're at, not too far from us. They've selected our product as their go-to-market, and we're offering their services as well as an optional component. You heard Airstrip mentioned. Airstrip came to us. Love those guys. They've got a great product. They own mHealth, interoperability within the hospitals. Great partnership to have. And what we're doing, I'm going to blaze very quickly through these, is scaling from the high-risk complex chronic to the mid-level, which is, let's call it the diabetics and hypertensives, using physicians to engage that population and mobilizing providers into clinics, nursing homes, and other settings using technology like yours. Here are some of the endpoints to accomplish it. We have experience in this space. These are on roadmap. They're coming with the real-time analytics. This is not big data analytics. It's real-time, listening to live data on the wire from the health systems to say, here are your 100 patients in the hospital right now that have an impact on that. I'm going to skip through these for the sake of time to get to some Q&A.
So that's actually a full 10 minutes. So we'll have to save the
Yep.
questions for after. But thank you very much
Sure.
for
Thank you.
Vivify. And thank you very much for attending, both in person and then also online. And we very much look forward to seeing you again next year. So thank
Great.
you.
Thanks, Dan.